our third part of our presentation, we invite Sister Matilda, who is clinical officer, asking her nicely to present us the health issues they have to face in our clinic. Mulanda Wino.
Thank you so much, Father. Yes, I work at the clinic as a clinical officer, and there are a lot of challenges that we're facing at the clinic. Of course, we've been facing these challenges, but now it has become worse because of the drought issue that we've had in Zambia. So one of the things that we have is malnutrition. We've seen an increase in the number of children coming with malnutrition. Not just the children, even the pregnant women, even just the adults, because of lack of food in the villages. The rainfall situation wasn't that good, and therefore people didn't harvest a lot of food. And most of the people here depend on agriculture. So with this drought, it has been very difficult to find food. And so we have a lot of cases of malnutrition coming at the hospital, pregnant women coming without food because of the same drought. Apart from that, we've had lack of water due to the same problem of rainfall. The water has gone down, the water table has gone down, and so now we don't have water at the facility, and this has caused a lot of cases of diarrhea cases. So we've got a lot of people coming in with diarrhea cases. Some are able to reach at the hospital, others are not able to reach due to transport issues, and some die just from there at home because of lack of transport. Transport is a very big challenge at the facility. We don't have an ambulance to take our patients to the next level of care, and so we find that there are some people who are coming. Of course, most of them are coming from far places to reach our health facility. By the time they reach our facility, their health is already deteriorating, and now the facility doesn't have equipment that we're able to do many investigations on them, and due to that we need to refer to the next level, which is Kabwe Central Hospital. But for them to reach that place, it's difficult because the ambulance is not there, and they have to look for their own transport, which is most of the times difficult because some they manage to reach, others they don't reach, others die on the way. So with transport issues, it's really a challenge, because there are some people whom we are called to go and pick them from their homes, but because we don't have transport, it's not easy. Some are managing to come with wheelbarrows, others with bicycles, but of course it's not safe even for a pregnant woman to be on such kind of a transport, even someone who is very sick, because it makes the condition worse than it was. So with transport, we are having challenges and we are losing lives because of the same. I talked about malnutrition, and this also has caused other problems. There was a time I was working in the night, and I received some cases of people coming in with food poisoning. They were getting food from the bush, wild fruits that are not eatable, but because they are hungry and they really want to eat, people have been picking even things that are not eatable. So we've had cases of poisoning. We even lost a life due to the same, and some were referred to the next level of care. Apart from that, this has also caused early marriages, because people are unable to take their children to school. The only solution is to take them into marriages. So you find that 14 years, 15 years, girls are taken into marriages, so that at the end of the day, the family can get something from these men who have something. And so we've seen a rise in early marriages, leading to early pregnancies, leading to complicated childbirth. Because these girls are still young, they are unable to contain a child, and so it's very difficult for them to deliver in a normal way. Most of them will refer to Kabwe for cesarean section, and now due to transport challenges, others have lost their lives. Apart from that, there's also high levels of promiscuity. We see some girls selling their bodies for just a few coins because of the same drought, which has caused to hunger in the country. And so would really need some help in all these things that we've talked about, in terms of equipment at the hospital, so that instead of them being referred to Kabwe, most of the things can be done from the facility here. We lack equipment like ultrasounds, we lack equipment like X-ray machines. So for all these, they need to go to Kabwe. For dental health services, they need to go to Kabwe because we don't have dental equipment. And for most of the things, the theater, like we've seen that we've got a lot of cases of early marriages, meaning that most of the cases are handled in the theater. But because we don't have a theater, we need to refer them to Kabwe for most of theater cases. So it would be nice if we can have our own theater here to lessen on the issue of transport. And yes, sometimes we might have the same transport, but looking at the place where this clinic is, the road is quite bad. So during rain season, we are almost cut off from Kabwe. So meaning that even if we have the vehicle, we will not be able to reach where we are supposed to take our people for next level of care.